My name is actually Roni Saltzman-Kamusa, and I've been a patient of Dr. Churn and Dr. Nguyen since 2012. I saw Dr. Churn actually for my right knee, in which I had my fourth knee surgery. I then went back to see Dr. Churn. It was August 18th of 2014 because my left knee was hurting, and he point blank told me that it is not my left knee, it is my back. And I said, no, it can't be. And he said, no, I'm telling you, it's your back. I said, okay. Unfortunately, I had an incident that day where my dad had passed away. So I stepped back a little bit, and then I went to see Dr. Nguyen, and I believe it was early 2015 because the pain was beyond excruciating. And Dr. Nguyen said, sent me for the MRIs, and he had told me you were going to need back surgery. And I was taken aback and scared, and at any age, surgery is scary. So I asked him to please, what can we do? And we started out with physical therapy. It was, helping a little bit of the pain medication. We did, epidural injections. Kind of helped a little bit. He kept telling me we really need to consider the surgery, and I had personal things that I needed to take care of, and I was very scared, but he kept reassuring me this is what you need to do. And I did what every adult with a child at home. I went and got a second, third opinion. I even went to the laser. I did everything, and he was very spot on with his recommendation. He told me exactly what needed to be done. So I did everything in my power to get everything taken care of personally, and I knew I had to get the surgery. And I'm 50 years old, and I was crying like a baby, and I told him, yes, I know I need to have this done, and you're right. So, which leads me to where I am here today with a whole new life. My daughter is actually 14 and a half. I'm very proud to say she's an honor student in high school playing field hockey. She played lacrosse and field hockey in middle school, and I can't even tell you how many games because I couldn't stand, I couldn't sit, I couldn't be comfortable. I couldn't go shopping. It was just like the little things. And personally myself, I play golf. I'm very active. I walk, I exercise, I do, you name it. I'm not a person to sit, to complain, to cry, and what I was given back by having this surgery, which, I look back at the 2 months, it was a long 2 months of recovery, but I now can go shopping all day long. I can go to every one of her games. I can do all the exercise. I walk 10 miles a week. I do my squats every single day. I do now all my leg lifts. I can even do a little bit of sit-ups. I can do anything I want to do. And I was thinking over the weekend before coming to this interview, and last week I was in work, and somebody made a comment to me. They're like, did you get taller? And I said, taller? I said, I'm 50 years old. I don't think I had a growth spurt. They're like, you seem taller. I said, that's because I can finally stand up straight. And I said, that's, to me, actually, kudos to Dr. Nguyen. I grew at 50 years old, and it's because I actually can stand up straight, tall, and this also might sound strange, but I wasn't able to wear a dress or a skirt with nylons or tights in 2 years because the pain was just excruciating. Anybody who has any kind of disc problem, and I had 3 of them, and how it happened over time, I had 4 right knee surgeries. I played softball in high school and college, and even as in my 20s and early 30s on co-ed leagues. I loved doing anything. It took me back, and it just in time wore me down. But now it's nothing but building my core muscles and exercising. And even Dr. Nguyen said the last time he saw me, I can see the muscle tones coming back, and don't worry about sometimes you do gain weight because you have lack of activity, but it's all falling into place. Thank you, Dr. Nguyen, for giving me my life back.